Texas Representative Brian Harrison joining me live this morning. He also served as Chief of Staff for the Department of Health and Human Services during the Trump administration. So you're the perfect person to talk to. You held the position the first year of the pandemic when things were really, really dark in this country and around the world. But I think I want to make sure that we're not just pointing the finger here. What can we learn from this staggering reality that COVID hit? No one appeared to know exactly what was going on, and there was so much back and forth about what the solutions were in the midst of that catastrophe. What can we do better next time?
Yeah, great to be with you. Good morning. And you're right, I was there at the beginning for the first year of the COVID pandemic. And your point about not pointing fingers, I really think is an incredibly important one to stress, because there certainly was a whole lot of that going on for the first year of COVID. And I got to give the Biden administration some credit. You know, after promising to blindly follow the CDC and whatever its findings were, wherever it led them, the Biden administration, after dealing with COVID for about a year and a half, is finally admitting the organization is in fact broken, and it has been broken for a long time. I mean, Director Walensky acknowledged that they've had 75 years to prepare for something like this. So there were institutional and systemic problems that we were dealing with during the Trump administration. So I do hope people will reconsider some of their criticisms during that time. And look, they have correctly diagnosed several issues of the CDC. It needs a cultural transformation from one that's erudite and academic and focused way too much on white papers and PhDs talking to other PhDs. They need to reassess how they communicate with the public in ways that are easy to understand, how they better coordinate with other departments within HHS and with the rest of the organization. One of the ways I think they need to do that is to get all the data up to the top of the department level, let it be standardized and then disseminated amongst all of the public health agencies so they're dealing with all the same types of public health information. But on the communication front, one thing that can't be stressed enough, I think, is the need for humility here and the need to understand that the CDC understands certain things that are hard science, but that there's a lot they don't understand. I mean, one thing we tried to press was this concept of radical transparency when we were there at the department. Tell the American people what you know, but be equally honest with them about what you don't know. And don't be so dogmatic in your guidances that have been, unfortunately, incomprehensible, confusing, contradictory. Just tell the American people the data you have on mass, the data you don't have on mass, the data you have on transmission, the data you don't have on transmission. And be more willing to coordinate and cooperate with expertise that's in the private sector. Just because it doesn't have a CDC stamp on it doesn't mean it's not great. You know, CDC shouldn't be in the lab test manufacturing business, for example. And I'll tell you one thing that could go a long way. If they really want to prove they're committed to following the science and following the data, irrespective of where it leads, is don't go looking for more staff, more authorities, more budget, and more diversity offices. Now that the CDC's own guidance recommends treating vaccinated and unvaccinated people the exact same, come out and oppose vaccine mandates all across the country. That would show the American people, it would show policymakers, it would show those in and outside of the scientific community. It's a new day. They're turning over a new page. Recognize natural immunity, oppose vaccine mandates. That would go a long way to showing they're very serious here. And
I know we're almost out of time here, Representative Harrison, but in terms of that natural immunity question, do you have any insight? Because I think a lot of people saw the CDC actually release some information, some data that there was some truth to it, some validity to natural immunity, but then that was kind of wiped away with the number of different vaccine booster shots that came out following.
Yeah, and this has been information that has been out there in the public sphere, in the public domain, in peer-reviewed literature for a very long time. And the CDC was so late to the game in even acknowledging that people could have not just similar immunity, but perhaps superior immunity from having recovered from COVID-19 than they would have had from just only vaccine-derived immunity. And those types of that hubris, going out there and saying, no, we're not even going to acknowledge this type of thing, really did, I mean, perhaps irreparable, I don't know, we'll see, but damage to the brand and to the reputation of the CDC that prided itself for a generation as the world's premier epidemiological agency. But they were refusing, they were intentionally turning a blind eye towards science. And I hope they're going to learn the correct lessons and not apply the wrong solutions. More staff, more government bureaucracy, more authorities, more diversity offices. If they go that way, they won't have learned the lessons. But more humility, more acceptance of what is truly known science versus what is unknown and still in the developmental phase. Oppose vaccine mandates. There could be a new day for the CDC, and I hope they take the right path here with a lot of humility.
Representative Brian Harrison, bringing up some interesting points worth looking into. Thank you very much for your time.
Great to be with you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.